Hello everyone and welcome to our podcast. My name is Silvia Segestrala and I work at Stanford Concierge Medicine Clinic. I work there as a nutrition consultant and wellness educator, and we are here today to talk about ketogenic diets and intermittent fasting. I'm super excited to bring to you two experts in the field, Dr. Lucia Aronica and also Dott.ssa Shebani Sethi. The reason we are here is because I like to keep on top of current trends, and also because I get a lot of questions from my clients about what is ketogenic diet and what is intermittent fasting. So with that, let's not waste any more time and let's go and meet them. Here we are. We have two experts in the field. The first one, as I mentioned already, is Dr. Lucia Aronica. She's a lecturer in epigenetics, ketogenic diets, and fast mimicking diets at the Stanford Prevention and Research Center and genomic platform lead at metagenetics. The focus of her research is understanding how genes and environment interact with each other to develop personalized nutrition strategies, and her greatest passion is helping people use science to live healthier and happier life. We also have Dr. Shebani Sethi, and she is a board-certified psychiatrist and obesity medicine specialist, faculty at the Stanford School of Medicine, and the founder and medical director of the Stanford Metabolic Psychiatry Clinic and Silicon Valley Metabolic Psychiatry Center. She's an expert on obesity medicine and adult eating disorders, where she treats patients with a range of metabolic and mental health issues and directs clinical research trials investigating medications and dietary interventions for metabolic and psychiatric disorders. So welcome Dr. Lucia Aronica and welcome Dr. Shebani Sethi.
Thank you for having us.
Thank you for inviting me.
So let's start. I thought it would be a great place to start to ask about how did you two meet? The university is really big, so how did this all come about?
Yes, that's right. It is a really big place. This is a huge campus, and I'm about 6 months postpartum, and I decided to, get myself to the gym. And when I went to the gym, I was walking up the stairs and I saw this advertisement for Lucia's course, and it was on the ketogenic diet. And I was like, oh my gosh, I really need to meet this person. Here I am doing a clinical study with the ketogenic diet in patients with psychiatric conditions, and here's Lucia who's doing this amazing course and teaching students and educating the public about ketogenic diets. So I thought to myself I should reach out to her, and we met and had coffee together, and we learned more about each other's work, and we've been in touch with each other since. And a lot of times in the medical community, there are a lot of misconceptions about ketogenic diets. So I found that it was really quite refreshing to meet someone who understands the science. And I am really thrilled to meet her, and it's a big win for me.
Oh yes, I'm thrilled too, and I'm looking forward to nurturing this friendship and professional collaboration for many years to come.
Likewise. Yeah.
So let's start with you, Dr. Aronica. Tell us a little bit more about your background and your interest in ketogenic diets.
My professional life is a love story between science and food. I was born in Naples, Italy, where I learned to cook, share, and love food. Italy is a place where food is a mean to health and happiness. But if food was my first love, science was my second. I fell in love with science in the year 2000, when the first draft of the human genome was published. It was an exciting time for science, and this motivated me to study genomics and epigenetics. I first pursued master studies in Italy, and then a PhD and postdoc in epigenetics, first at the University of Vienna and then at the University of Oxford. And the study of epigenetics transformed the way I looked at food. I realized that food is not only calories, it is biological information. It is the most powerful signal to our genes, the most powerful way of transforming our health from the inside out. And that's how then my two big loves, food, so food as medicine, and epigenetics, science, married with each other. And I decided to move to Stanford, where I am leading the epigenetics analysis of the diet fits study by Professor Christopher Gardner, the largest randomized clinical trial ever undertaken to compare low carb and low fat diets. And I'm also teaching courses in genetics, epigenetics, and personalized nutrition.
That's pretty impressive background. I attended one of your courses, in fact, two of your courses, and in your courses you describe ketogenic diet as a type of fast mimicking diet. Can you tell us a little bit more about that?
Yeah, sure. Ketosis is the hallmark of fasting, and a common feature of most fast mimicking diets. So fast mimicking diets are diets that reproduce, mimic the effects of fasting by inducing a metabolic switch from using glucose to using fat as fuel. And in this process, we break down body fat and turn it into ketones, which are miniature fatty acids that can cross the blood-brain barrier and provide a fuel for the brain when blood glucose is low and we don't either restrict carbohydrates or we fast.
Okay.
And understanding the link between fasting and ketogenic diets can help us debunk the myth that ketosis is an unnatural and dangerous state, and help us frame it actually as an essential, natural metabolic state that helped us survive during evolution.
Yeah.
And actually, fasting was the first way people got into ketosis, even before the word diet was invented. And ketosis was essential for unlocking our body fat and turning it into ketones to provide energy for our brain during a period of food shortage. And the reason why this was crucial is that we can store only a limited amount, so a number of calories in our glycogen, which is the way our body stores glucose. We can store approximately 2,000 calories as glycogen.
Oh, wow.
In contrast, we can store more than 100,000 calories in our body fat. And we need to either restrict carbohydrate or fast to tap into a gold mine of calories. And so ketosis was essential for human survival during evolution, but it's also crucial during the development of brain development in newborns and brain health as we grow up. And as a matter of fact, the ketogenic diet was born as a fast mimicking diet in the 1920s when scientists realized that fasting was beneficial to improve symptoms in epileptic children, and formulated a diet that could reproduce effects of fasting without fasting. And voila, the ketogenic diet was born.
Oh, that's an amazing story, and that gives us a little bit of background into how ketogenic diet is similar or links into fasting. And for our audience, can you describe a little bit, or can you highlight any differences, key differences between ketogenic diet and intermittent fasting, or just fasting in general?
Oh yes, perhaps the most important difference is how ketosis is induced and to which extent. So fast mimicking diets such as intermittent fasting or periodic fasting usually induce intermittent and mild ketosis by restricting when on how much to eat. Whereas a ketogenic diet induced a sustained ketosis by restricting what to eat, carbohydrates,
Okay.
and without restricting calories. And this has reflects into physiological differences because only sustained ketosis can induce keto adaptation, which is a process, so it's a broad spectrum of physiological adaptations in our mitochondria, liver, muscles that ultimately transform the way our body processes carbohydrates and fats. And another important difference is the emphasis on diet quality. So while most fasting protocols don't require people to change their usual diet, a well-formulated ketogenic diet requires to really choose high-quality foods that are low in carbohydrates but dense in nutrients, such as green leafy vegetables, fatty fish, nuts, meats. And while this is, of course, more challenging than simply restricting when and how much to eat, there is room for flexibility. So there are 1,000 ways of doing a ketogenic diet. A vegan keto, a pescatarian keto, a flexitarian keto, and finding the one that is going to work for you is the key to success.
Okay. Tell us a little bit more about your background and how you got interested in ketogenic diets and how you use it in practice.
For me, it all started about a decade ago, and I was in medical school. I took a rotation in obesity medicine with Dr. Eric Westman at Duke University Medical Center in North Carolina, and he is really, for those who are not aware, he's really the pioneer in the low carbohydrate and ketogenic community. And in his clinic, I saw many patients that were doing really, really well on this dietary approach, and they were getting off their medications. I mean, normally you go to a doctor and you get a prescription and you walk out the door with another medication to take. And this was a completely different paradigm. So I was really inspired by that change that people were making with their health. In fact, I saw many of these patients that had psychiatric illness as well. In fact, I saw a patient with treatment-resistant schizophrenia who would not respond to our conventional medical treatments. And with the ketogenic diet, it really proved for this patient to be far more powerful as an intervention compared to medications. So this experience just really inspired me to dig further into the literature. And what I found and what I noticed was that there is this huge overlap of mental illness and obesity and metabolic disease. And when I say metabolic disease, I'm talking about obesity, I'm talking about diabetes, I'm talking about heart disease. So what I have found is that mental health symptoms like depression or anxiety or psychosis are actually improving when I treat the metabolic disease. And part of my research is formally studying what a ketogenic diet intervention, which we know is anti-inflammatory, and how it affects metabolic health parameters as well as mental health. And when I say metabolic health parameters, I'm talking about reduction in cardiovascular disease, cardiovascular factors. And this is in a patient population of folks that struggle with schizophrenia or psychotic spectrum illness, as well as bipolar illness. So we are gradually coming to an understanding that inflammation and metabolism actually play a significant role in the development of mental illness itself. And I find that to be, quite fascinating, and more research needs to be done in this area. And more people around the world are doing research in this area.
Sure. I find it very powerful that with one diet intervention, you can actually address two things, right? You can address the mental health of a patient, and also you can help to prevent metabolic diseases. So with that, I actually have a question for Dr. Aronica. So I find it really interesting that by using one diet protocol, ketogenic diet, you can actually improve the health of a patient, both from a mental perspective and also improve their metabolic health. This is a really powerful concept. And with that, I have a question for Dr. Aronica. You do a lot of research into ketogenic diet. What are you working on currently?
Yes, the central question of my research is how can we personalize nutrition based on people's unique characteristics? Why some people can tolerate more carbs and fat than other people? Why some people succeed on a diet and why others fail? Why some people can stick to a diet and other people cannot? And specifically, I'm leading the epigenetic analysis of the Diet Fits study by Professor Christopher Gardner. And the main idea of the study is that one diet doesn't fit all. And we want to identify biological markers, biomarkers, that can allow us to predict which diet is going to work for which people. And we are looking at the hottest biomarkers in personalized nutrition. So metabolic biomarkers, proteomic biomarkers, the microbiome, genetic and epigenetic biomarkers, which are the focus of my research. So the word epi means on the top. And so epigenetic markers are chemical groups on the top of our genes that can turn them on or off without changing the genetic sequence. And what's exciting about epigenetic markers is that they respond to lifestyle factors such as diet, and therefore enable a whole new layer of personalization when used to predict diet response. For example, in our study, we see that people that go on a low carbohydrate diet turn on genes that are involved in breaking down or making ketones by changing their epigenetic markers. And this makes sense, right? You eat more fat and you produce more enzyme that can metabolize fat. But now the burning question is this going to work for everybody or only for those that respond well to the diet? And that's where we may be able to use epigenetic markers to predict diet response. And we are trying to answer these and other questions that hopefully will make personalized nutrition a reality in the next years. Some of these other questions are: do men and women differ in the way they respond to a low carbohydrate or low fat diet? Why some people experience huge increases in cholesterol when going on a low carb ketogenic diet and other people don't? And is there a better biomarker than glucose to predict the way we respond to carbohydrates? These are all exciting questions, and I'm thrilled to tackle them in the next years.
Dr. Sethi Dalai, we've heard so much about the benefits and how exciting and powerful ketogenic diets can be. But do you find from your practical clinical experience that there are some concerns that you would have?
Yeah, a common misconception that I often get in practice from patients is, asking me if this is just a fad diet. And it is true that it is more popular right now, and it's also true that it's really caught, mainstream's attention. But actually, it's been a diet that's been around for hundreds of years. And in fact, in the 1920s, it was used as a treatment for epilepsy. And this is treatment-resistant epilepsy. And it was very effective. And this is before the medications even came out. The pharmaceutical companies came out with these medications like valproic acid, Depakote, Lamictal, topiramate, or gabapentin. And these medications are medications that we often use to treat seizures. And as psychiatrists, we often also use these medications to treat bipolar illness or depression and even in anxiety. There may be something similar about what the ketogenic diet does in the brain compared to what the medications do in the brain. And the difference or the advantage is that the folks who are doing ketogenic diet also are reducing their cholesterol or their lipids, and they're decreasing weight, whereas sometimes for some patients these medications can contribute to weight gain. And it's not for all people, but for some people it is.
So now a question to both of you. We've heard so much about ketogenic diets and the latest research, and we've heard about the clinical perspective. Are there any closing remarks that you would like to share with the audience? Dr. Aronica? Let's start with you.
Probably the importance of moving away from polarization towards personalization in nutrition, and challenging one size fits all truths, and finding individual answers to live life at the fullest. And we need to work together to make personalized nutrition a reality. We will need to be humble, skeptical, proactive, and optimistic. Humble in knowing that we don't know. As the philosopher Socrates said more than 2,000 years ago, that science is less about having the answers and more about looking for them. Skeptical in knowing that what works for some people may not work for other people. Proactive in educating ourselves, experimenting, self-experimenting, monitoring ourselves, and engaging in our own health decisions. And most of all, optimistic, because if we don't believe we can change ourselves and the world around us, we won't.
Thank you. And Dr. Sethi Dalai?
Yeah, as a clinician, I would want to leave a closing remark about caution, because the ketogenic diet it's really an intervention, and it's not a diet for everyone. And it would be best to have someone who's trained and understands what a ketogenic diet is, can review your medical history to see if it's appropriate for you, as well as, especially folks that are on medications.
Sure.
And they need to be tapered safely off those medications, whether they're psychiatric medications or whether they're medications for blood pressure or for diabetes. It needs to be safely managed. And so if you're interested in a ketogenic diet, talk to your healthcare provider, talk to someone who's trained in either obesity medicine or an internist who's familiar with the ketogenic diet, or a nurse practitioner or a nutritionist who's familiar with it. That would be what I would.
Thank you, Dr. Lucia Aronica, and also thank you, Dr. Shebani Sethi Dalai.
Pleasure.
It was a wonderful experience to have you here. I hope you enjoyed watching us as much as we enjoyed this conversation. If you would like to learn more about their work, please check out their websites and their social media.